loud.
Hello, everybody. Welcome back to Medical Monday.
Welcome back.
We're going to be going over the hip today.
The hip.
The hip is a very large joint. It's not the largest one in the body. The knee is, but it is oftentimes, with the amount of muscles that control the hip, a very complex issue. And it's so complex that actually there's a wide range of who gets hip issues. You have about 1 to 10% of the population gets hip problems. That's a big difference. But it's because the different categories we have. Asian population actually very low risk, about a 1% chance. They fall within the very low risk of having hip osteoarthritis or hip problems throughout life. But who is at more risk are females. Females do have hip problems more often than men. But what we really see is that your occupation and your genetics play a major factor in hip pain. And an article from Osteoarthritis Cartilage talks about heredity and genetics playing the most significant role in if you are going to be one of the unlucky persons that gets hip pain.
So when you're talking about the 1 to 10%, you know, there are certain factors that put you in the 1% of that number, but also there are certain factors that put you in the 10%. So it really just depends on what your demographics are, what gifts you got genetically, things like that. Is that what you're?
Exactly.
Okay, gotcha.
Depends
so it's
on
a different spectrum of who's affected in regards
who's
to
at
that
risk.
Okay.
Who's at risk. We're talking about the epidemiology, which is basically who's at risk and what population, whether it's gender or ethnicity, is going to put you at risk for certain diseases. And with hip problems in particular, one of the big ones is your genetics, but your second biggest factor is your occupation. Yeah. And what do we see with patients who normally come to us or have hip problems? What do they normally complain about?
Back pain, hip pain.
Yep.
Difficulty getting around.
Range of motion issues. They can't move their hip. Getting in and out of a car becomes an issue because you need your hip to swing your leg out. Any type of other movements, if you're doing yoga and you can't do certain poses, if you have arthritis, we're talking about intrinsic and extrinsic. Intrinsic is within the joint space, like arthritis. And then extrinsic is outside of the joint space. Those are all your muscles and ligaments. They can have problems within your hip. They can cause pain. But one of the big things we have with hip pain, first off, is it referred pain? So we talk about referred pain. This is a hip, a lady's laying down, but the muscles that move the hip are actually connected to her back.
Low back.
Patients will complain about, well, my back hurts. Well, that's the muscles that are in the hip is causing this pain, and that's why it's referred. So we talk to patients like, well, you got hip pain and you got back pain. Which one came first? It's always the chicken and the egg.
Yes.
Most patients, if you have hip pain, you have back pain. And if you have back pain, you end up having hip pain.
That is very correct. And that's what's wonderful about what we do here is because, you specialize in regenerative medicine and those joints. And me as a chiropractor specialize in the spine. So, no matter what the cause is, we can help correct that. We can help.
And that's a good thing about working in a multidisciplinary office.
Yes.
We're able to help with those. But it's not just the cause of the pain that's concerning, it's the cost. There's always cost in things that we do.
And there's different aspects to cost as well. There's not just the cost of it, but the effect of having to pay that out or go through that.
So there's about $300 billion a year that are spent on osteoarthritis, and hip is one of those considered in there. And the actual cost of medical care is less than half of the overall cost. So that's odd sounding because the cost of medical care is expensive.
Yeah. You
look at your average hip replacement from $80,000 to $100,000 to include the medications, the OR, the equipment, the rehab. $80,000 to $100,000 is a lot, but that's not the most being spent on hip pain.
Because you talked about a lot of things that cause downtime. That cause things from me getting back to my life and what I need to do.
Yep.
So
that's the biggest cost of hip pain.
That's the biggest cost.
That's the biggest cost. Not the $100,000 hip replacement.
Not the procedures and the rehab.
It's all of the lost time from work. Because before you go into a hip replacement, you've got multiple rounds of physical therapy, multiple doctor's visits. You're going to see all these specialists, and you've got to take time off of work to do that. And then also you got to take time off of work if you were to have some of these procedures. Some of them can take up to about 6 weeks before you can get back to doing some of your functions.
Wow, 6 weeks.
So cost of healthcare is more, or the cost of lost wages is more than the actual cost of the healthcare to help take care of your back and or your hip problems.
That is significant. So what, you know, we're talking about the hip joint itself, the things that cause issues. So what exactly would cause or have me have some type of joint issue, especially, you know, specific to the hip line? What would cause me to have a hip problem other than being a woman? Right?
Other than being a woman.
Other than being a woman.
There's a couple of things. All your joints are the same. They all consist of some type of structure being held together for movement. And it's always held together. Bones are held together with ligaments. And then there's muscles, because muscles have to move these joints. So those muscles are connected to those bones through tendons. Sometimes those muscles, the tendinitis, which is the inflammation of the tendons, or issues with the ligaments themselves, can cause damage within that joint. But the joint itself is relatively simple until we start looking at specifics within the joint and how complex it can get. This is a hip joint right here.
Yes.
Look at how many different muscles there are for this hip joint.
And these are larger muscles, right? We have different categories of muscles. These are the larger, more superficial or up top muscles. You see how this was the muscle we saw a moment ago that attaches to the low back. That's the muscle that attaches to the low back and comes in over to the hip. Then you have all these thigh muscles in your leg. You know, this is what allows that joint to move. And so any injury to any one of these joints can cause an effect of any kind up.
So we look at a joint. Let's talk about how muscles move joint. Muscles only pull. So like with your elbow, we'll use this because it's easier to see for the camera. So this muscle has to pull my arm up.
Oh, look at that bicep.
Then there's got to be a muscle down here to pull it down. That's very simple. You're just going in one plane of motion.
Yeah.
Think about your hip. All the different movements that it can do requires so many extra muscles, which then, as we know, can cause so many extra problems. The more muscles and ligaments and tendons we have, the more options for pain.
Yeah. And so I wanted to show this. We actually have a model here. So this is your low back here. All those muscles you see actually cover this area. So we just have the skeleton structures here. With that, you can see this is called a ball and socket joint, okay? Because it literally goes in any direction. It can rotate, it can twist, it can flex, extend. I mean, there's a lot that it does. And so when you're talking about the complexity and what these muscles do, it allows this joint to go in so many different directions and do a lot of different jobs, whether it be from walking to sitting to transitioning from one position to another. Like there's a lot there. A lot that this.
So much so in there that these muscles, they actually have what's called bursal sacs. They're kind of like little lubrication areas in between the muscles because the muscles flow over top of each other. Sometimes with overuse, patients will have a bursitis. The lubrication area in between there will become inflamed and very painful. Those are the ones that the patients, they touch a specific area like, ow, that's very tender. Sometimes that's the cause of it. So you not only have the structures that move the joint itself, but then there's also some other areas that can cause pain and discomfort.
Yeah.
But the joint itself, look at this, it's very simple.
Very simple, very simple. So there's only two bones involved in the hip joint, and that's the ilia, which is this part here. This is the ilia.
It's like your pelvis there that you would have.
Yeah, and then the part of the femur, this is called the femoral head here. And so that
this is your leg bone.
Yep.
So this is your leg bone coming in. This knot on the side, sometimes you'll feel that on the side of your leg. That's your greater trochanter. But a little bit above there, about 2 inches, you'll feel a soft spot. That's as it falls into the hip joint itself. And it's just a ball encompassed with very smooth cartilage. It needs to be smooth to have, and it's got to be solid because it needs to give comfort for patients as they move their leg. But sometimes we look, if they don't function properly, all these muscles don't have good function, they're going to cause dysfunction within the joint space itself. If one muscle's tight, if one muscle's out of alignment, it's going to cause that joint space to have improper pressure on different areas. And it can kind of wear away much faster than what it should.
Yeah, it can.
When it does wear away, what do we see? Arthritis.
Arthritis. Yes.
This cartilage be nice and smooth on this hip, and you see holes within it. That's that Swiss cheese about as it deteriorates or degenerates over time.
And this was the joint we just looked at. This is the same joint that we looked at. It's just got the effect from that head where it's not as smooth. And so this is where a lot of that pain comes from when we talk about arthritic change. And it doesn't just affect the bony structure of the femur itself, it affects the whole joint space. You talked about the bursa, there's fluid in that joint as well.
Yep.
And so when we start to see those changes, like what we're looking at here, you start to have an effect on the joint space when we talk about that fluid. And it's a matter of supporting the whole system and definitely focusing on correcting the problem is what needs to happen.
So with that, you look at the movement of the muscles can cause extra pressure, but also extra weight can cause extra pressure. The Joint Bone Spine Institute noted that a higher BMI, which is body mass index, weight, does cause extra pressure on that joint space and can have it wear down faster than what it should.
Yes, it does. For every pound of weight that we are overweight, that is 3 to 4 extra pounds of stress and pressure on joints. So when you talk about that, that's a significant number, even if you just talk about 10 pounds overweight. Yep. That's 30 to 40 extra pounds of stress and pressure on our joints. We only get joints for the length of time that they last for our life. And we don't ever want to see patients get joint replacements because it's not a beautiful process.
There's not a lot of studies that we see as far as how do we treat hip pain because the knee is always the number one concern that most patients have. So we see less medications on the market. We see less rehab procedures for the hip. But what we do is we relate a lot of the treatments from the knee to the hip so that we can get good results with it. I know there's a great medication, the hyaluronic acid.
Yes.
That's the gel within the joint space. We're seeing more and more of that being the standard, the first use that we do. But right now, the FDA has only approved it for the knees, study and focus. So they study and focus, and hopefully we'll see some additional things for the hip. But before we start treating any problems within the hip, what do patients do at home? What's your first thing you do? You have hip pain. You're not going to call me first. You're going to try something at home.
Yes.
What are those great options?
Yeah. So typically at home, you're going to use what you have around you. We use an acronym. It's called RICE, R-I-C-E, and it stands for rest, ice, compress, and elevate. I've actually put a visual together.
Because we talk about it on every condition, whether it's shoulder, knee, there's muscles, ligaments, tendons, bone, any condition, we talk about RICE. How can people remember what RICE actually is?
So I did a little research and I put a visual together for everybody.
I want to see it.
Yes. So I really like this. I put a lot of time. So we've got rest. We've got rest.
He seems pretty restful.
Yes, he seems very comfortable and restful. And it's about the quality of the rest, not the quantity of the rest sometimes. It's really a matter of finding that comfortable position and allowing yourself to recover. Ice, we need to remove the inflammation from the area, especially if it's a fresh injury. We need to compress. The hip itself is a very small joint, but it's in a very large area when we look at this. There's a lot of things to work around. So finding something that helps to stabilize that and compress the area and then elevate that hip. That 2-year-old's doing a great job, but even when we talk about the hip, these things are convenient things we can do at home, but who's going to do that?
I don't know. He's doing a good job of it.
He is doing a good job, but who's going to do that? So when we talk about the hip, RICE is going to help. Right? But it's a complex hip and where it's located, how we can do these things, and also the convenience of it. If you don't have other people to help you with experience, there's a lot of aspects of this that actually are more difficult than meets the eye.
So not only your normal things become difficult with the hip, but we also talk about activities. People who have hip pain usually have done a physical activity and they're anxious to get back to being physical. And we want that for our patients, but we always want to stress to be a slow progression. You want to take your time. As you're resting. That downtime is going to affect your ability to jump back into whatever you were doing, whether it's golf, tennis, running. You want to slowly progress back into that activity, not back at the same level you were doing before you took a month off, because your body has changed. So you don't want to re-injure yourself too soon. You always want to do a step process to come back into exercises. But if your home treatments, your RICE, and your slow progression into back to your exercise is not worked, what do we normally do?
We end up starting to go to the pharmacy, right? We go and do what's called over-the-counter medications. We find out what, again, RICE is convenient, right? So what's the next most convenient thing? Something I can just walk in the
your Tylenol, your Motrin, your Advil, all of those.
Topical rubs even. There's a lot there. The second step from there is let me go to the doctor and get something to get the edge off, and that would be prescription medications.
So oftentimes when patients come, they're like, well, I've tried this or I've tried that and it's not working. That's where we need to step in and do something more for pain relief, and that's when there's multiple prescription options to help with that. But even with those, the patients, it's alleviating the pain, it's not fixing the problem. So oftentimes the prescription medications, we end up prescribing more or stronger ones, and then eventually we end up having to move into actual injections within the joint space, which is great. It gives good comfort, good relief, but it still falls in the category of medications that it's not fixing the problem. It's just relieving the pain, which patients want, and I understand, but let's get to the root of it. But there is one other fix.
Yes, there is one other fix. And we never want to see that. Here in the office, typically we see patients that come in who have done the prescription route, they've done the at-home route, they've done the injection route, they're not getting the results they want. It's continuing to get worse because they're taking more and having it done more often. So, that's when we typically see patients coming in the office. It's too late when...
Because they don't want to take that next step.
Correct.
The next step.
A hip replacement,
this is permanent.
Yes, as needed as hip replacements are for a certain percentage of the population and for the patients that get them done. We see patients in here that we have to say, it's, we can't help that.
Unfortunately.
Unfortunately. So
but it
is the last resort.
Last resort.
And these are the numbers that we talked about in the beginning. This isn't just about the cost of the surgery. This is about the cost of the downtime as well, before the state of the surgery and then during the 6 weeks of rehab and recovery, and then also the effects after the fact. The time spent even after the 6 weeks of recovering and compensating and things like that. So there is a lot there when we talk about hip replacements, and we're here to help avoid that.
So some of the things that you can do to avoid, if there's patients that have gone down this route of a couple medications here, maybe an injection there, got some relief, the pain's coming back. So you're on this slow progression towards the end all of a hip replacement. But within the Natural Solutions regenerative pain clinic like this, what we want to do is fix the problem. And how do we do that? There's a couple of things that we start with. Just as much as anything. We want to find out, one, what's the problem? Is it your hip or your back? And that's why we have chiropractors to help.
We work phenomenally together, right? So is it coming from the low back? Is it coming from the hip? Those are the aspects what allows us to actually distinct ourselves from other offices and other facilities, because we're able to hone in and better figure out what is the cause. And if it's both, absolutely, you're in a great place to help with that as well. And then the other aspect that we've talked about is rehab, right?
Obviously, there's multiple muscles within that joint space.
It's insane. It truly is. It's insane. And so with that, we're able to hone in on specific muscle groups to help strengthen, specific muscle groups to help stretch out. Like, where are we restricted? Where do we need more movement? Where do we need to strengthen? Because we have too much movement, too much laxity there. So, with the rehab exercise, especially in conjunction with chiropractic, it allows us to really hone in on the tissue and allow it to better function and do its job the way it needs to. And one of the other things we do here in the office to help with it as well is decompression. This is a Back on Track unit. This is what we utilize here in the office. And, you would already hit on, there's tons of studies about the knee in regenerative medicine. It's the same thing with decompression. There's tons of study with the knee. This is a very hard joint to hone in on. Our decompression units allow us to work on both the low back and then indirectly help with the hip. So when there is more involvement with the low back, it allows us to better get results with the hip and open up the changes that we need to see in there.
How many patients do you see low back pain is now making them walk an inappropriate way that's now causing their hip pain? We see a lot of those, right?
Oh,
if you can take away
99% of them. 99% of them have.
So if you can take away their back pain, just in itself means you walk better, more natural, and less strain on your hip. That's what you want to do. Less strain on the hip. Same thing with a rehab. The muscles need to function properly so you have less strain on the hip, because we want to get to regenerating it. We want to get to fixing the problem, right?
And I want to talk, I think a great example would be a tire, right? When we rotate our tires, we align our cars, because I don't want to buy a set of tires every 6 months because the inside's bald and the outside's fine. We rotate our tires and we align our vehicle so we get the best wear and tear on those tires, make them last as long as they can. This is a very similar situation. When we start compensating from an old injury, whether it be from the low back, from the hip, from the knee, it doesn't matter. They're all very close, right? Specifically today is the hip. But anytime you're compensating for something, there's an effect there. So we need to make sure we align it and support it so that we can allow for the best wear and tear, allow for the less compensation, because now you're making other things do a job it's not designed to do. And to go back to the car analogy, that's why when our cars aren't aligned, they shake. and they're hard to drive, right? And so with that, we need to do the same thing when we're compensating. We need to correct it so that we're not shaking, we're not making things do a job they're not designed to do.
And the joint in the hip is like every other joint. They're encapsulated. There is no blood flow in the joint space. So unfortunately, it's a nutrient poor environment. So when it's having to compensate, when it's having uneven wear, it's not able to heal itself. Unfortunately, it just deteriorates. But with the solutions as far as how to fix that, one, get the muscles, get it back in alignment to where it's not having these unnatural forces on it, but how can we get it to heal itself? One of the things that we utilize here in the office is called platelet-rich plasma. And I actually have some right here. This is a patient's blood. It's spun down. And the red blood cells are down here. We don't use those. We don't need them. We do the magic right here. And this is where the platelet, what they do is they start the healing process. When your body has an injury, such as a cut, you cut yourself, what stops the bleeding is the platelets.
Yeah. Are you okay if I pick this up again?
Sure, go ahead.
The sticker was behind it. And so I really want people to see, the clearness, that buffiness.
We call that liquid gold right there.
Liquid gold. That's what allows the healing to happen. So I wanted to make sure everybody got to see.
So it starts the healing process just as much as if you were to cut yourself and your platelets stop the bleeding. They also got to heal that wound. What we do is we put that within the joint space so that it can heal whatever wound is within there, that cartilage. We seen the photo earlier where it looked a little bit like Swiss cheese. But a big part of platelet-rich plasma, we do under ultrasound here, into specific muscles, into specific tendons. Where this pain is located, we can see it under ultrasound, and that way we can directly inject onto that injury to where your body can heal itself much faster. And platelet-rich plasma has been around for decades. About 93% of all professional football, baseball, and basketball teams utilize it to keep their players on the field because it helps them heal much faster. And it's a great option. We have a spectrum of regenerative things within the office, but it's a very good first option to utilize. And it's very affordable. Just because high-end athletes use it doesn't mean it's not affordable for normal people like us. And with that, then we move on to another spectrum. And this is the regenerative solutions that we use, the human cellular tissue products. It is a regenerative concoction, multiple different cells within there, and about 200 different growth factors.
Wow.
A phenomenal product that's actually harvested from a female in America. She's got to be under 35. She has to have a scheduled C-section. That way the donor team can be there to harvest the placenta. Because the baby's healthy baby is born and does its thing, and we used to throw away the placenta, but now what we do is we harvest it because of the regenerative properties within there, the multiple cells and growth factors that we can have for a great concoction to help the body start its healing process to heal that cartilage, that Swiss cheese cartilage that we have. And we keep it here in the office.
Yes.
We got a little, just like sperm, is kept under cryogenically frozen, so whenever we thaw it out, can be injected right into the joint space and start the healing process. It's a very good product with phenomenal results. And as you can see there, it's a little bit cold, but of course we thaw it before we inject it to make it a little bit more comfortable for the patient. It's a very easy injection. It's not painful like a steroid injection, and it really starts the body on a great healing process. But we talked about hip pain, what it is, what causes it. We talked about some of the things you guys can do at home, as well as what we traditionally would see, and then what services we do.
Yeah, what we can do here in the office to help, and that's what we're here for, right? This is why we do what we do, so that we can help prevent things from happening in the future, and then also to allow you to live the best life that you can. So if you're watching this and this is something that you think you would be a great candidate for, even something that you have a friend or a neighbor, click the link below. I know that there's a way to reach out to us via digitally, and then also give us a call, 936-494-1222. The office is always available to take messages and schedule appointments, answer questions. There's no better time than now to take care of you. The big thing we say here in the office is, you're essential, your health is essential, and we're an essential healthcare facility. So that's why we're here and doing what we're doing. And if you have hip pain or if your friend has, that's what we're here for.
Great. So give us a call if you have any of these conditions.
Yep. We'll see you next time.
That ending lags on.